All right, I'm gonna take a sip of this and breathe for a second. Every day, working with student athletes, and student athletes we consider lifelong student athletes. So people who are learning and competing, and so that means student athletes of all ages. Now, when you're working with that most competitive age, and whether or not that's middle school, high school, college, professional for some people, it doesn't matter when it is. During that point in time, there's going to be situations where challenges arise. And when these challenges arise, they might result in injury, or they might result in, just pain and discomfort. When these situations come up, you need to know what to do and who to go to get answers. And at first, when you don't know what's going on, you can be general, you can generalize, you can go to a generalist, somebody who can say, hey, listen, I'm going to give you an example. Hamstrings are an issue in most sports. And so when you're dealing with a hamstring, you really need to be specific. A lot of times people say, oh, they pulled a hamstring, or oh, the hamstring was tight, or most of it's generalized. So it's kind of okay, but if you're really going to treat something, eventually you need to get specific, and you need a specialist. That is exactly what you need. So for the hamstring, for instance, a lot of times people are like, oh, they make generalizations. They say things that they might think that are true, that actually a lot of these things are wrong. So here's one generalization. Oh, their hamstring's tight. Yeah, it's up near the top. And so I'll show you. What they'll do is they'll say right up here, near my butt, and my hamstring's tight. It's very rare that your hamstring would actually be tight up near that area. It might feel like what you think tightness feels like, but it's actually not tight at that point. It's overstretched. Now, where the hamstring can be tight, but where it's typically tight is actually down near the knee, not up near the top. So what you're saying, generally speaking, is wrong. Specifically, who knows, you might be that one person that's tight up there. Most people, though, are overstretched in that area. They are not tight. They might be an overstretched because a lot of times there's an anterior pelvic tilt. Well, we're not going to get into specifics right now because we're speaking generally, because I don't know you personally, and I'm just telling you this so that you can hopefully do some research for yourself. Now, as it relates to the hamstring, there's a number of different things that can be going on. It might actually be nerve related. So you might want to go see a neurologist that works with the nerves, the spinal cord, and the brain. However, going to see a neurologist isn't necessarily going to take care of the nerve pain if the nerve pain is being caused by something that you need to see a chiropractor for. Now, you could go see an osteopath, that's great. The point is, there's different things that could be going on in different places that will affect this hamstring issue. So you can start off with a massage therapist, and if you release the hamstring and the other impacting muscles around it and get it back to normal, and then get a strength coach or a physical therapist, or some athletic trainers at colleges are trained in a field where they actually know how to get you back to where you need to be. That's great, but there still may be a nerve situation there. There still could be a spinal situation there, and you may need to see more than one person. It's a complementary approach. It is a holistic approach. You can still come from a Western medicine standpoint, but it's a holistic approach because you need to know specifically that everything is where it's. Now, if all of a sudden your hamstring feels great and you no longer have to worry about it, that's fine. But you can't be generalizing things other than just in the beginning. You need to step back, see what's going on generally, and then as you can, drill down specifically to get to what's really going on, find out who's really going to help you, and then consistently move forward. It's not going to just be one miracle cure. And the thing is, that hamstring turns into a bunch of other problems too. And the hamstring probably wasn't the initial problem, it was probably something else. It might be the way that your foot is striking the ground. It might be the way that you run. Instead of pushing, maybe you're a puller, and maybe you get your hip a little bit too far in flexion, and then all of a sudden you heel strike and then pull from there instead of pushing into the ground. And it depends on the sport, what you're doing. Specifically, how are you training? How are you then recovering from these things? What are you doing to prepare yourself for whatever it is that you're doing that's the most stressful and impactful on that particular muscle and or on that system? Because the hamstring by itself isn't just, you can think about it as a muscle, but it's better to think about it as the movement that's bothering you and the movement range of motion or the angles of motion, or the point where you're getting the most leverage on the ground, or where it's getting the most pull or push on that muscle. There's a number of different things to think about. And if you have an injury coming up, then it is worth your time to sit down and think about and ask people. People will have injuries and or pre-injuries, and I'll say, listen, this is what I'm thinking. What are you thinking? And I'm thinking about it more than they're thinking about it. And then we'll have parents and other people reach out and say, hey, listen, and the hamstring is the most common one. That's why I'm giving it as an example. And it's also one of the ones that's the most confusing for people, because they'll look at it and they think, oh, their hamstring's tight. And then they grab right underneath their butt. And your hamstring, most of the time, I'm just telling you right now, is not tight there. You might be the exception to the rule, but most of the time, it is not tight there. It is overstretched there. And where it's tight, usually is down where it flexes at the knee. That's exactly what usually happens. Now, there's a bunch of different things you can do to take the stress off it. Once you do take the stress off it and help out the other muscles as well, you need to retrain it, okay? There is something usually going wrong, either dysfunctionally with your movement, or you have an overcompensation in one area, or maybe the quad to hamstring balance muscularly is off, is not at the right ratio for you, or something structurally off with your hips, or maybe one leg's longer than the other, or there's all these other things going on that people just don't look at. And I understand it's not your profession, but it is your body. So you have to step back into the general and then drill down in specifics, and then get people to help you out muscle-wise, get people to help you out bone-wise, nerve-wise, all the different things that you need to look at. And if you're in high school, then you need to probably start with your general healthcare practitioner. And if you're not in high school or middle school, and then you're in college, you need to go to the head of sports medicine at your college, or your head trainer, or at minimum your head coach, or your position coach, and find out what the proper course of action is for them. Now, unfortunately, there's not a ton of schools out there that have people always thinking this way, but you need to ask this way. You need to be your own proxy. You need to be the person who is lobbying for your own care and, rehab or prehab or whatever. But these are things that you want to talk about. Now, if you have something going on with some musculature, like anywhere close to your torso, chances are there is some sort of implication from your alignment, which is why I talked about alignment the other day. I'm not over pushing chiropractors, but the bottom line is the vast majority of student athletes that we see have something going on somewhere in their spinal column. It is not for me to treat this. It is not within my scope. I can look at the muscle side of it and I can say, hey, listen, this looks like something's wrong. You need to go see this person. I'm not a nerve person either. I'm not a spinal cord person. I'm not a brain person. But I can tell you, hey, listen, this is something that you probably need to go get a referral for, and I would do that. So it's in these situations where when something's coming up, you need to pay attention to it. You might need to look at your movement, and that happens by videotaping yourself and seeing what it looks like when you're performing. What does it look like in practice? What does it look like? You should have these things at your disposal. A lot of people will be like, oh, you're blowing this out of proportion. Hey, listen, if it's important enough for you to do and spend time on, then isn't it important enough for you to review? If it's important enough to do and spend time on and energy and money, isn't it important enough to review? And if it's not, then I guess you'll do whatever you're going to do and you'll deal with whatever the consequences are. I certainly hope that's not your approach, but that seems to be most people's approach.